Good afternoon. I'm Congresswoman Alma Adams, and I am so honored to join you here at the Black Maternal Health Equity Summit. I bring greetings to you on behalf of Speaker Mike Johnson, Democrat leader Hakeem Jeffries, and the Black Maternal Health Caucus, of which I'm a founding member and co-chair with Representative Lauren Underwood of Illinois. I also want to acknowledge a great member of the caucus, your representative, Ms. Chantel Brown. And I want to thank the Dean of the Case Western School of Medicine, Dr. Stanton Gerson, and University President, Dr. Eric Kaler. I wish my schedule permitted me to join you in person, but I'm honored to report to you from the front lines of fighting for women's health care and health care for our mothers. And let me tell you what inspires me to do the work that I do here in Congress. On April 12, 2016, Kira Johnson checked into a hospital with her husband, Charles, to give birth to her second child, Langston. Kira was a healthy 39-year-old Black entrepreneur and a marathon running travel fanatic. This was hers and Charles' second child together, and the pregnancy had been perfectly normal, with no reason for concern over complications as she prepared to give birth. After a completely routine C-section, Charles noticed that his wife was not recovering normally. She suffered in severe pain for hours, while medical staff did nothing. When Charles pleaded with nursing staff, he was told that Kira was not a priority to them. She died only 12 hours after giving birth. It saddens me to recount this story, and we have legislation in Congress to ensure that her experience was not in vain. I'm of the opinion that the color of your skin, the zip code where you were born, or even your tax bracket should not determine whether or not you or your baby gets to live. But the cold reality is that burden endures. And as many of you know, for some communities and for Black maternal health, these disparities have gotten worse this century, not better, even in the wealthiest nation in the history of the world. Just as importantly, Kira's story is not an isolated incident, and my goal is to eliminate the need to continue telling it in the future. Our healthcare system is not serving us equally, and we must correct that. And that's why Representative Underwood and I continue to champion the work of the Black Maternal Health Caucus to raise awareness about these intolerable realities facing women across our nation. Since beginning this work, I've spoken with countless women who know either a survivor or victim of maternal health crisis, or who survived it themselves. And this is why we introduced the Momnibus Act, a collection of 13 bills that address the core of and targets the disparities that exist for Black women. Within the Momnibus is my signature bill, the Kira Johnson Act. Once this bill passes, it will fund grant programs that implement racial bias training for all employees in maternity care settings. It will provide funding for community-based organizations that support doulas, midwives, and other perinatal health workers. It will address social determinants of health, like housing and transportation and nutrition, something that is especially needed here in Charlotte. And it will fund respectful maternity care programs in hospitals, where pregnant and postpartum patients can report instances of racial bias to promote accountability. It's important to me that we talk about bias in maternal care, and clearly it's important to you too, as you've come together to address these same inequities at this summit. I believe that Kira Johnson's care team needed this training, and I'm grateful to providers like you who are willing to learn new ways of caring for patients. The Momnibus Act is also focused on improving the quality of care and uplifting the voices of patients, much like the mandates of this organization. Your insights and advocacy as healthcare providers and community advocates directly influence the creation of our bill and continue to steer all of our discussions and legislation at the federal level. In the past year, there's been a lot more focus on the Black maternal health crisis following a recent report from the Centers of Disease Control. But even more profound, for the first time in history, the White House has made the Black maternal health crisis a nationwide priority by implementing new legislation and robust, steady, reliable funding toward research of the root causes of this crisis and medicine and technology to finally bring it to an end. I believe the Biden-Harris administration will soon sign another bill of mine, the Stillbirth Prevention Act, which has sailed through Congress nearly unanimously. We're bringing people together under common sense advances that reflect our common humanity. The Biden-Harris administration's policies draw on many facets of the Omnibus Act mentioned above, and will also invest in community-based organizations and HBCUs to train culturally competent health professionals. All good work starts with coalitions and partners who are committed to doing what it takes to eliminate the disparities once and for all. Partners like you. So together, let's continue to mobilize our communities through gatherings like this to maintain momentum at the federal level. And of course, all action done at the federal level must be met with action at the state and local level in our hospitals, in our clinics, and in our doctors' offices. It's a privilege to work alongside each of you to realize this vision of quality healthcare and thriving futures for our Black mothers and their children. And thank you for your time today. And thank you for all that you do for our communities now and for the future. God bless.